Hello and welcome. You're watching Coronavirus Facts versus Myths. I'm Gargi Rawat. First up, what we're discussing is why Indian vaccines are not being recognized by the UK. Now, the latest changes in the UK government's COVID-related travel restrictions have upset the Indian side, as travellers who have got both doses of the AstraZeneca vaccine will be considered unvaccinated and will have to undergo 10 days of quarantine. The new rules, which were unveiled on Friday and will become effective from October 4th, under these rules, only people who have got both shots of a double dose of vaccines such as Oxford, AstraZeneca, Pfizer, BioNTech or Moderna will be considered vaccinated, but only from certain countries. Effectively, this means even Indians who've received both doses of Covishield, that's the local version of the Oxford AstraZeneca vaccine, and one of the two main vaccines being used for the domestic immunization program, will be considered unvaccinated. Remember, Covaxin is still not considered in international travel. Now, the chief coach of the Indian women hockey tweeted from Netherlands that he had to undergo vaccination again as his Indian Covishield was not recognized. You can see that tweet, his third vaccination done since Covishield is not recognized here. He's like, it's really unbelievable that 1.3 billion Indians have been vaccinated with Covishield and we just can't get it here to approve. Also, Jairam Ramesh, Congress leader, reacted to this news, saying it's absolutely bizarre considering Covishield was originally developed in the UK and the Serum Institute, Pune, has supplied to that country too. This smacks of racism. And Shashi Tharoor has cancelled programs in the UK because of this. He tweeted, "Because of this, I have pulled out of a debate at the Cambridge Union and out of a launch events for the UK edition of my book, Battle of Belonging." He says it is offensive to ask fully vaccinated Indians to quarantine. The Brits are reviewing it. So that is what he has claimed. So what can be the reason behind the fact that these vaccines are not considered? Now, what we can tell you is back in August, the World Health Organization had said that it had identified counterfeit versions of India's primary COVID vaccine, Covishield. In fact, after that news came that WHO has flagged concerns about counterfeit versions of the vaccine, the center had then sent out a warning to all states to take action against fake Covishield vaccines, and even said that they were conducting an inquiry into this entire matter and that all states and they shared parameters to help identify genuine vaccines with all states. Well, to talk more about this, we're joined by Dr. Veer Pushpak Gupta, physician, National Health Service. Thank you so much, Doctor, for joining us on the program. So please explain this to us, because it's created a lot of outrage here in India. Many, questioning whether this is racism and why would UK not recognize the Covishield vaccine, which is the same vaccine that has been used in the UK as well, the Oxford AstraZeneca vaccine.
Yes, thank you for having me on the show, Gargi. Look, I absolutely agree with the anger that is there amongst the Indian public and also the Indian hierarchy and the government against this bizarre decision. I mean, it's absolutely bizarre why certain countries are being allowed the same vaccine and certain countries are not being allowed, and especially a country like India that has vaccinated more than 80 crore people, which is a very large number, second only to China in the world, that has vaccinated their own people at such high numbers. Producing a UK vaccine in India, in the Serum Institute, and not being recognized as one of the vaccine that can be approved. It's bizarre. Let's look at what the UK has come out with. So the only countries that are allowed to not quarantine with the same vaccine is either the European countries or the United States, the UK, and certain countries in the Middle East. Now, even in the Middle East, there's a disruption between a discrepancy between UAE and then other countries like Bahrain, Kuwait, and Saudi who are being approved, but UAE is not being approved. So I'm not sure what thinking has gone behind this kind of policy making, but the three biggest nations that are vaccinating their people, Russia, China, and India, have all been left out of this kind of, whatever protocol that they've made. And it only reeks of vaccine colonialism. That's the only word I can use because, certain countries in the West are being allowed with the same vaccine and the countries in the East are not being allowed. And I think that we need to sort of bring this up in the way that it's being brought up. Diplomatic channels have to be used. If you remember, India was on the red list for the longest time, and there was a lot of noise made about that, and India was taken off the red list afterwards. So I think this has to be brought up to the highest levels. And I appeal the Indian government and Indian missions abroad to sort of bring this up and make it easier for Indians to travel to the United Kingdom and other Western nations.
Right, Dr. Veer Pushpak, what we do know, and what, this point that I made was that we do know that the World Health Organization had earlier flagged counterfeit vaccines. They genuinely found in some countries in Africa and in Asia, they found counterfeit Covishield, which was checked by the Serum Institute and found to be counterfeit. And after that, the Indian government also reacted. There was this letter sent out from the center to all the states to identify if there are any such, counterfeit vaccines, fake vaccines, and also that an inquiry would be done. So, is it possible that this is the reasoning behind this, that, do they feel that perhaps because the WHO flagged this, that's the reason for now that they've, made these rules for Indian travelers?
Counterfeiting of vaccines has been an issue all around the world. It's been an issue in many countries. One of the ways that we've tackled it is that we have specific batch numbers of vaccines that are used, and those batch numbers are then put onto the database that is being used to collect the information of people that are vaccinated. And then that database is used to see through the app, like CoWIN app or the NHS app over here, whether the person has been vaccinated with the correct batch number or not. Now, I'm sure that is being used in India, but however, people find a way to counterfeit things. They find a way to get around it. And I think, of course, that needs to be cracked down on very strongly. But as you said, this has been taken seriously by the government. It has been cracked down on. And I don't believe that the countries that have been left out of this policy have been only left out because of this reason. Because if that's the case, then why are countries like UAE being left out? Clearly they have a setup which is of international standards and are using vaccines like Pfizer, Moderna, and Johnson & Johnson and AstraZeneca. So why have they been left out? So it doesn't make any sense. I don't think this is a particularly targeted thing at India or at Indian vaccines. I think this is generally a sort of division between the Western countries and the Eastern countries. And that's why I use the word vaccine colonialism, because I feel that, this is what it is. It's discrimination based on where the vaccine has been given rather than where the vaccine has been made or which company the vaccine is from.
Right, and hopefully India will work those diplomatic channels to ease this sort of issues that Indians face when they'll arrive in the UK. So currently, and these rules come into effect on the 4th. So currently, what are the rules in UK and what is the COVID situation?
So currently the rules are that you have the red list, the amber list, and the green list. I think that those lists are going to be scrapped from the 4th of October. And India is on the amber list. So everybody that comes from India will have to quarantine for 10 days and will have to do the day 2 and day 8 tests, which are quite expensive. And, quarantining and sort of the costs of all of these things will add up. Of course, they don't have to do the hotel quarantine as they had to do previously when they were on the red list. And that has obviously helped a lot of Indians, especially Indian students that are starting their terms in universities in London and all over the United Kingdom. This September, the universities have opened up. So it's made a huge difference. Again, Indian diplomatic channels were used. I was on NDTV. We talked about this issue and India was taken off the red list. And I think that we need to do that again. In terms of the COVID situation at the moment is quite stable in the UK. I would say that we're having a daily case numbers of, it's much decreased than before, but about 20 to 30,000 cases. However, the hospitalizations are very low. ICU admissions are very low. The main ICU admissions that we are seeing are in unvaccinated youth and unvaccinated pregnant women. And those are the main cases that we are seeing in the hospital. Otherwise, the vaccinated people are being protected. There's sufficient antibodies in the society and in the community itself to protect people from the virus. So far, so good.
Right. And doctor, what we do know is that vaccinated people can also carry the virus and pass it on, because that's been an understanding. And do you think, but the example in UK, the fact that it's not, that the numbers have come down, those going to hospital have come down, and given that a majority are vaccinated, that this shows how this disease will eventually become endemic?
Yes, I think so. And I think, you can see both the numbers and the point that you made is very, very true. Vaccines will not protect you from getting the virus. You will still have cases that are increased because we're having 30,000 cases every day. That means 30,000 people daily are still getting COVID and testing positive for COVID. However, not all the 30,000 people are ending up in hospital and ending up in ICU like what we were seeing before. If you just take Google and you look at the numbers in December in terms of deaths and hospitalizations versus the numbers now, you will see that it's come down significantly. I mean, in December, we were having about 1,500 people dying every day. Now we're having about 100 to 150 people dying every day, which is still a significant number, but very, very much improved than it was before. And I think if that is not a proof that vaccination works, then nothing is. And the only way out of this, we've been saying this for months, the only way out of this pandemic is to get yourself vaccinated, to protect yourself. And I want to reiterate this for pregnant women. I'm seeing a lot of pregnant women at the moment that are not vaccinated due to fear of their babies getting harmed due to the vaccine. Well, the actual reality is that the woman herself will be harmed. She's the one that is ending up in ICU after giving birth to the baby, and she's the one that is actually dying from it. So please, even if you're pregnant, this vaccine is quite safe. Get yourself vaccinated. Get your family vaccinated as soon as possible is the only message I can give.
All right, that's an important point to make. Thank you so much, Dr. Veer, for joining us on the program.
Thank you very much for having me.
Thank you.